views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is a pleasure to have with us today Dr. Maricruz Rivera-Hernandez, Assistant Professor in the Department of Health Sciences, Policy and Practice at Brown University. Maricruz, welcome.
Thank you so much for having me here.
Our pleasure. So you've been doing some cutting edge work on Hispanic Medicare beneficiaries, a complicated, complex topic. Tell us a little bit about your work.
Yes. Thank you for the question. So primarily, I have looked at access and quality of care among Hispanics Medicare beneficiaries. When I came to Brown as a postdoc, one of the areas that I was interested in looking at was how Hispanics choose Medicare Advantage plans and then the quality of care that they receive. I primarily focus on long-term care access and supports. And some of the things that we have found is that A, Hispanics tend to enroll in Medicare Advantage plans at a higher rate than other groups. And B, also when they go to nursing home care, they often reside in facilities that are lower quality compared to their counterparts. This also happens for Black residents and Hispanic residents. So we have noticed that minority residents tend to receive lower quality of care compared to other beneficiaries.
So is that lower standard of care something that is intrinsically linked to Medicare, like lower payment thresholds, or is it more complex than that?
Great question. So it is a combination of things. In the past, researchers have noted that some of these quality facilities, like if we think about Medicare ratings, the ratings go from 1 to 5, 5 being the highest level of care, and high star ratings. This quality of care facilities are rated, 3 or below, often are located in minority neighborhoods, like more segregated neighborhoods. So to begin with, access seems to be more restrictive for these populations. These facilities tend to have higher proportion of residents that are paid by Medicaid, which also influence the quality of care that these populations receive, like having less access to staffing and having lower quality in certain measures.
So, for the longest time, there's been obviously heated debate about healthcare generally and the coverage of healthcare. So one might anticipate that the public at large understands these macro differences, but my bet is that many don't. So is it fair to say that Medicaid is largely an income-based plan, such that if you have very low income at any age, that you're eligible for Medicaid, versus Medicare, which, again, correct me if I'm wrong, and I readily could be, that you're eligible for Medicare if you're 65 years or older, or you're younger than 65 and have some form of disability. But Medicare is not necessarily linked to income. Is that fair, or is it linked to?
Yeah, those statements are correct. You
Okay.
describe, the programs. Yeah.
So if those statements are correct, then it is interesting that the facilities that Hispanic and African American, or Latinx and African American older adults tend to be treated in or live in when they are older also have higher rates of Medicaid patients, because that would suggest that those facilities are more likely to have low income patients. And now it's doubly complex, because now we're dealing with age and income as it relates to the quality of care at the community-based agencies, et cetera, assisted living that folks go to. So tell me a little bit more about, like, I'm almost that old now, but if I was trying to get care for my mom and I was considering Medicare, and what should I be asking? What should I be researching so that I can get the best care for my parent, but whilst utilizing Medicare? Is that a fair question?
Yes. So and that's very interesting. So when we turn 65 and we qualify for Medicare, there are a number of choices that we have to make, which makes this process very complex. And many researchers and myself have talked about this quite a bit. So we have the option of going into traditional Medicare, which is, or Medicare Advantage. Medicare Advantage is managed by insurance companies like Blue Cross Blue Shield, United Healthcare, and others. So the difference is that Medicare Advantage, you have to choose a plan, like an insurance plan. So you have to go, and there are websites and information available for people that are eligible. CMS, the Centers for Medicare, have a website dedicated to informing consumers about the different plans available within the area. And you go and you enter your zip code, and it will give you a display of the different plans. Now, some areas have up to 50 plans where people can choose from. And there are differences in terms of the benefits that they offer. Some plans might have dental, vision, which a traditional Medicare doesn't have. Some plans might be zero premium plan. And some plans are also rated, like the nursing homes that we were describing before. Plans are also rated 1 to 5 stars. Again, sometimes minorities tend to go to plans that are lower star rating, because often they want plans that have lower premiums and might have covered some benefits.
Got it.
And a lot of people don't know that plans are rated.
Yep.
And that you can switch plans if you're not comfortable and you don't like the one that you have currently, and that there are these sites available for you to actually do some research.
Sure. Yeah, it makes complete sense to me. We've had guests on that have talked about health literacy and variations in health literacy by various racial ethnic groups, and also socioeconomic strata. And I can readily imagine that huge proportions of the population have no knowledge of any of those things. When they're making those selections, I'm almost embarrassed asking this question, because I'm sure the answer is maybe yes, but it's another problem of access. Are there counselors that help people make those kinds of decisions? But I suppose even if there were, they'd have to know that those counselors were out there. How does an urban inner city 70-year-old navigate the system. That seems difficult to me.
Yes, so there are programs available, like the state health insurance program that helps Medicare beneficiaries. They provide them with like knowledge and alternatives about what they can choose. But yes, they like people have to be aware that these programs exist. So now these days, because the state health insurance program have fought for funding and to inform consumers about this, their information are part of the documents that sends to beneficiaries. So hopefully when beneficiaries are receiving, the documentation, like it's time for you to think about Medicare and enrolling into Medicare because you're going to qualify soon. Hopefully now the consumers are reading and finding that there are these programs available everywhere in the U.S. And they can help them navigate. These programs are run by volunteers that are dedicated to helping consumers and other adults to make these choices that are very complex. But yes, when I have interviewed older adults before, they were like, no idea that that I could go to these companies. A lot of older adults tend to go to senior centers, which sometimes often some help and bring different representatives from insurance companies and other programs to provide this kind of information. But again, some of these older adults have to be part of either a senior center or hopefully now read that this information is available and that they can use it.
Sure. I mean, I can only imagine, and you hit the proverbial nail on the head. If a 3-star provider has a lower premium and a 70-year-old person is living on a fixed income and isn't given the proper guidance, of course they're going to go with that. That makes complete sense. And yet what probably has not been considered, that with substandard care, they're going to get sick faster, longer, and that's going to have an enormous cost. So that the additional cost to get to that 5-star place ultimately is going to probably save them a ton of money and have better health. But without the proper guidance, I can certainly imagine, people make poor decisions when they have the right information in front of them. How do you make effective decisions when you don't even have the information? With just a little time left, what is the concrete, specific advice that you would give to our audience so that they can get the information they need to make these critically important decisions?
Yes, it's very, selecting an insurance plan is very complex, just because, as you mentioned, you have to think about the level of risk that you're willing to have. Are you thinking that you are going to be healthy for the next 10, 15, 20 years? Or are you considering that you are going to be dealing with some issues related to frailty or other chronic conditions? And how much money can you invest in that? Do you have savings? Are you living just on Social Security? So I would highly recommend going to the CHIP programs, the state health insurance programs, and talking to volunteers about what your options are, and and what are some of the best alternatives available for you at the geographic level that you are part of the city in our county.
Got it. So find the health volunteer affiliated with your state health program, call them, speak to them. If you don't understand what they're saying, tell them that you don't understand. Ask them questions. Don't be intimidated. Make that call. In a little bit, we're going to take a quick break. When we come back, Dr. Rivera-Hernandez is going to tell us a little bit about her life story and how her undergraduate education and beyond set the stage for this excellent work that she's currently doing at Brown University. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at bronxnet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So we're here today with Dr. Maricruz Rivera-Hernandez. And Maricruz, we always start with the same question. Where were you born? And tell us a little bit about your formative experiences.
Yes, I was born in Culiacan, Sinaloa, Mexico. So I'm from Mexico. The northwest part of Mexico, very hot and humid over there. And I went to college at an institute near my city. I was living at home at the time. So I commuted from home to college. And I love learning. So college was a great experience for me. I did something related to administration and quality control. And there was a lot of math involved, which I found very useful later on for my graduate studies. And I stayed, 4 years going back and forth from home to college. In between, I did some summer research programs, which I really appreciated and set me up later on for a career into a researcher.
Wonderful. Tell me, just so I get a sense of the spatial aspect of this, if you were at your college or at home and you drove directly north, what would you hit first when you get to the United States?
You will hit, if you continue going straight north, it can be either California or you can go through Arizona.
Got it. Okay. So when you say northwest, you mean northwest. Okay.
Correct.
Very good. That's helpful. And so let's come back to your college experience. What was your family's stance? Were they supportive? Was there a tradition of going to college? Were you the first? What was the context?
Yeah, no, it is a tradition. My mom, it is an expectation that we are going to go to college. My mom was very supportive as to what kind of career we wanted to do and what major we wanted to choose to go through that path. So I have, now two, but I have three sisters, and all of us went to college and were to the same university. There were a couple of options in Culiacan, either the autonomous university or the polytechnic one. So all of us tend to go to the polytechnic and have a career related to either engineering or informatics. Got
it. Very nice. And tell us a little bit more about your undergraduate experience itself. Were there elements of it? You already alluded to math was a major focus and that turned out to be very helpful when you started your graduate studies. That makes a lot of sense. Were there elements of that experience that you found to be particularly beneficial or helpful just in terms of the learning you did and how it set the table for things to come?
Yes, I will say that statistics was one of my favorite subjects. And I use now a lot these days. I found that extremely useful. I enjoy going through the different sections of statistics that we have. We had like 4 or 5 different courses. And it was one of my favorite ones. I used that also when I went to the summer research program that was in Central Mexico. and we learned to put together how to collect data and how to run some analysis that were not strictly related to what we were doing at the university level. But I really love learning about the community and how to employ some of the tools that we were learning when we were going to these classes.
Fantastic. So you finish your undergrad. What was your next step?
Yeah, so I had a job for a year, and I worked purchasing parts for a major grocery company, and I enjoyed my experience, and it helped me a lot to decide that I did not want to do that. So I applied to an exchange program to learn English and learn more about the language and the culture here in the U.S. So I came. Part of the exchange program was to learn the language and work with the family. So I did that for 2 years.
And where did you do that?
In Ohio.
So you went to Ohio for a kind of 2-year immersion. You lived with a family, learned English. What was that like? Ohio's got to be a little bit different than home, I would guess.
It was a lot different. I was homesick for a little while, and then I got used to it. I love learning about the culture. It was so very different. It was the first time that I left home from more than a couple of months. Because I did that summer exchange program, and I left home, beforehand. But for this, the commitment was at least 1 year. So, at the beginning I was homesick, but then after that, I decided that I like the U.S. and I wanted to learn more about the U.S., the healthcare system, and the culture. So I applied to grad school, and I went to Miami, Ohio, to continue my graduate studies.
Very good. And what was your program of study? What was your major at Miami, Ohio University?
So I started a master that was related to environmental health, and I learned a lot of GIS, and I decided that I wanted to apply that with a little bit of population health. So after that, I went to my program in gerontology. So that's how I became a gerontologist. And right now I'm merging the two together, gerontologist and sort of like the environmental health GIS related things. Because one of my projects that hopefully will be recently funded, but one of the projects that I'm working on are related to the impact of Hurricane Maria in Puerto Rico and how that has shifted quality of care in Puerto Rico, which, by the way, there are Medicare beneficiaries there, and have influenced the quality of care that they receive right now, as well as migration, because a lot of people left Puerto Rico to come to the U.S. during Maria.
Yep. GIS, I presume you mean Geographic Information Systems Mapping. So
yes.
Just for our audience, why don't you give us a thumbnail of what GIS is and how it's helpful to you and how you're linking that to your work in gerontology?
Yeah, so you use tools to map different patterns. It can be any type of data. You can look at population size, disasters. I conducted a project looking at the shift in older adults living in specific areas becoming more like a naturally occurring retirement communities, because we know that if older adults have a choice, they would love to stay at home as opposed to going into a nursing home or other areas. So we were looking at some of those shifts between using census data from like 2000 to 2010, and you could see the pockets where these populations were becoming older.
Got it. So the GIS is you're literally mapping data points so that you can visually understand how various behaviors or responses to healthcare, in your case, or the way in which people access healthcare may differ by location, so that you can better target resources. Is that fair?
That's one of the tools.
Fair enough. Good. Yeah. I think it's a great tool, and certainly the study of gerontology, I'm sure, benefits from it. So you did when you did your graduate degree at Miami, Ohio, what was that degree? Was it a master's or a doctorate or?
It was both. I started with a master's and then I started my PhD program.
Got it. And
Yeah.
what was your PhD in?
Gerontology.
Okay, you said that.
Yeah.
Okay. All right. So you moved into gerontology as a function of your doctoral program, or that was a choice you made. Tell us a little bit about your doctoral program. Was there, practical experience that you did in the community, or was there a mentor that helped you? Because usually at a doctoral level, you're in a lab. Tell us a little bit about that experience.
Yes, I have a mentor that will guide me through the process of learning more about specific data. And since I wanted to do research on different research tools, which I take this as a way of also saying that our center at Brown is part of the Leadership Alliance program, which I don't know if you're familiar with, but in this program, we encourage students that are at the undergrad level right now, different institutions that are minority, or they might be first generation students going into college. And some of the students have come to the center to learn more about the research that we do. I have mentored a few students through the Leadership Alliance that are from other universities. One of my students actually was from Center College, and she went and ended up going into a PhD at Brown University in the behavioral science program. So the students come and work with the mentor, which I like I did when I was a PhD student. And the mentor, helps the student to understand some of the resources that we have, the data that we have, and some of the tools that we use to conduct some research, and hopefully encourage students to go into grad school.
Wonderful. So with just a minute left, Maricruz, if you were to give one piece of advice to someone watching this program about why and how to attend and succeed in college, what would that be?
That's a great question. I love my experience as a college undergrad student. I learned a lot about, in my case, about statistics that turned out to be very useful. The difference here in the US is actually you can learn different subjects, right? In Culiacan, we have to choose one path, and that was it. It was very strict, but it is not the case here in the US, which I love. I love that you have the flexibility of learning different subjects. And if you are not decided that that's the one that you want to focus on, that you can, switch or learn or get a certificate or something in addition to your major. So for me, going to college was something that was encouraged by my family. And I love that they encouraged that because I love my experience and that, and what the opportunities that I provided later for me to really have a job that I love.
Wonderful. I want to thank Dr. Maricruz Rivera-Hernandez. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. This is Public Health America. See you next time. Take care.